There's a new study out that talks about some new benefits when you follow the Mediterranean diet, especially for women. Let's bring in CTV News medical specialist Dr. Marla Shapiro with more. Good morning, Dr. Marla. So we've all heard by now about the Mediterranean diet, but just remind us of the principles of this diet.
So for many people, it's radically different than the way that they eat. It really focuses on avoiding red meat more than anything else. And in terms of the food that you are going to eat, it's more plant-based. We like to look at fish. We like to look at nuts. If you just look at the graphic, you see all those foods on the side that's there. And you want to limit salt. It does incorporate a little bit of wine. And one of the things that it really talks about is not only the types of foods that you're eating, but that food should be a social event, that food should be a positive thing. But you really see that this is mostly vegetables, fruits, beans, herbs, nuts. So it really is staying away from those red meats more than anything.
What are the benefits of this diet?
So it's got lots of benefits overall in terms of men and women, in terms of lowering risk for heart disease, hypertension, dyslipidemia, which is cholesterol and high triglyceride. So it really supports brain health, healthy aging. But now this new evidence is really looking at protecting stroke in women. And this is so important because for us as women, we have a much higher risk of stroke, both hemorrhagic and ischemic, than men do. And I'm sure you'd be surprised, as I was when I looked at the number, that 45% more women die from stroke than men do, and more women live with disability from stroke than men do. And it takes a sharp increase in midlife, around menopause, as we get older. So certainly looking at what we can do to decrease the risk of stroke, aside from the obvious in terms of exercise and not smoking and all of that good stuff that we talk about,
so
looks at this diet.
This study says try to adopt this diet to reduce your risk.
100%. So if you look at the study, it was 100,000 women followed over 21 years, and it looked at the incidence of stroke in women who really stayed with a high attention to the Mediterranean diet versus those with lower attention to the Mediterranean diet. So it followed these women, and there were about 4,000 strokes that were seen in the 100,000 women with no history of prior strokes. Most of them were ischemic, meaning low oxygen supply, as opposed to a bleed. And when you looked at women who had a high adherence to the Mediterranean diet, so followed that diet that we showed you, in fact, their overall risk of stroke was 18% lower than women who didn't adhere to the diet. And specifically, we saw a 16% reduction in those ischemic strokes and a 25% reduction in the bleeding type of stroke risk, the hemorrhagic stroke. Those are huge numbers that, you know, when you look at the impact of lowering cholesterol with medication, we see upwards of those kinds of impacts. But this is based on diet and really is highlighting that food as science and medicine, and really having a significant reduction in such a disease that has such disability and fatality is huge.
Food is medicine. What is your big takeaway then?
My big takeaway is really take a look at the way that you're eating.
Yeah.
And if you're eating red meat, you want to cut down on that. You really want to eat more plant-based food, fish, olive oil, as opposed to, for example, butter and margarine. Cut back on that red meat, as we suggested. Full-fat dairy is not a bad thing, but you want to cut back on it, not every day. Moderate alcohol only. And remember that, you know, the way that you eat is, you know, a function of your life, your relationship with food, your relationship with people, but it has significant impact both for men and women, but particularly for women in stroke.
Okay, really interesting. Dr. Marla, thank you so much for bringing us this. Appreciate it.
See you next time.